Thank you, Vladimir. I'm going to share my screen now. And first of all, I'm thankful to Ima inviting me to do this talk, because not something which is not the kind of talks we do here, and also it's rekindled my interest in this subject. And I'm also thankful for letting me do this in one or two sessions or three sessions, because it's to do justice to the greats of the past and the ancient. We need some time. So I'm going to give you a brief outline of the development of neuroanatomy from the ancient times. We know that it is such an old profession, neurosurgery. And it's probably the oldest medical profession, I have to say. And actually, in all of the profession, is only the second oldest profession. And you know what the first oldest profession is, which is prostitution. So neurosurgery may be the second oldest profession. As you can see from this skull, from Peru, and you can see that the evidence of trepanation, where the part of the skull was removed, and a very skillful South American surgeon replaced this with a gold plate. I mean, I can't describe the accuracy of the plate. It is so contoured, and the wound has healed as well, which is a miracle given that there was no medicine, there was nothing at that time. So this is just a wonder at that time. And we think, the neurosurgery in particular is very stressful, and there is litigious around the world, and you can get into trouble for making mistake. But think about our ancient physicians who started treating patients. If you look at the Egyptian culture, you can see this Code of Hammurabi, which was in 1700 BC. So if a physician makes a wound and cures a free man, he shall receive 10 pieces of silver. But only 5 if the patient is the son of a plebeian, or 2 if he is a slave. However, it is decreed. The rule was that if a physician treats a patient with a metal knife for a severe wound and has caused the man to die, his hand shall be cut off. So this is the time, this is how the physicians used to practice in those times. And we talk about our stress these days. And I took this from the opening chapter in Principal Neurosurgery, and I'm thankful to late James Goodrich, who written a beautiful chapter on the subject of neurosurgery and history. If you look at the timeline, and I'll go through this in detail later on, we can see the neurosurgical anatomy developed based on the anatomical dissections, and anatomical dissection wasn't there all the time. If you look at these are all centuries and before Christ, 2500 BC, and there was not much of a dissection going on around here, but you can still see some spikes of dissection and the positive attitude towards the dissection here. And that's often related possibly some sacrifice and rituals. But later on, during the Egyptian era, during the mummification or embalming process, there was some dissection more. That's why you see during the reign of pharaohs, you can see some dissection going on here. Then we come to this era, the Alexandrine and the Roman era. You can see there was a lot of dissection, especially around this area here. And this was influenced by various things in religion and the mummification, religion and philosophy. Those all influenced the process of anatomical learning. But to me, I think the most influence was from the thirst of knowledge. I have to say the Greeks had the most insatiable thirst for knowledge about human anatomy and learning. So that's what prompted this era here. And we talk about all this era in the next few minutes. And in 1300 BC, we could consider the Egyptian physician Imhotep as the first physician to the pharaohs, and he was probably the specialist at that time. But then we all have the mummification or the embalming process, which involved some dissection, possibly evisceration, and that of course will involve removing organs, so you have to name the organs. So this is how it started. First of all, to learn these things, you have to name these organs, and you need to know where the organs are and what organs are there. And this will involve making a cut in the abdomen and removing the organs and filling with some cedar oil to dehydrate it. But the brain was removed with a hooked instrument. And I can only imagine the specialist who did that process must be very skillful to go through the nose to remove the brain contents. Because you have to find, I suspect they must have gone through the cribriform plate, because as somebody, people like us, we know that the skull base is very strong, and I can only imagine they must have gone through the thin orbital roof or the cribriform plate to enter the brain cavity to remove things. But these specialists are considered high in their society. They could walk in and out of temples and offices with impunity. Nobody would ask them. Such was the status they had at that time, because they were so skillful. That's because only the affluent could do this embalming or the mummification for their bodies, to preserve their bodies for the afterlife. And the common man could not do it because such an expensive process at that time. And this is the oldest documents we have about the healing process. This is the Edwin Smith papyrus in 1700 BC describing a head injury, which is astonishing if you imagine people were looking into it at that time. So let's divide the whole anatomy, the ancient history for neurosurgical anatomy, mainly into three parts here. One is during the time of Hippocrates, and then the Alexandrine period, the Greeks, and then you have the Roman Empire. So during this time, we know that even in ancient Greece there was some human dissection in around 600 BC, but the beginning of learning about brain and how it worked subsequently happened with many philosophers. They were all actually, they were very knowledgeable persons. Nobody was a specialist anatomist or a physician. They're all philosophers and anatomists and physicians at the same time. So they must have been really clever. For example, Pythagoras. We heard about Pythagoras in mathematics because we learned about Pythagoras' theorem in mathematics. But also he traveled around the world and he went to Egypt, and also he reasoned that the brain probably was the source of the reasoning. And then came Alcmaeon of Croton in 500 BC. He did some dissections, and he is credited to have identified the eustachian tube at that time. And he was first to identify brain as the seat of understanding, and he differentiated the process of understanding from perception, because they are different processes. Understanding is one thing and perception is another thing. He said animals can perceive, but they do not understand. Because that crucial point, he was the first one to describe it. And he thought the brain was the center of emotions, knowledge, mind, and the soul. And he also attributed the sense of organs with the brain. So which is a remarkable thing. We're talking about 500 BC. Then when we come to the next person who contributed to the development of our specialty or physician as a medicine as a specialty was Hippocrates. Hippocrates truly called the father of medicine. We all take it, when we in all the medical school we take Hippocratic oath in some form or other when we start our medical career. And he's the one. He's lived around 460 to 377 BC. And he took everything from the other cultures like Sumerians and Egyptians and Jews and took everything significant that is needed to learn the art of healing. And even 400 years before Christ, he separated medicine from other like magic and witchcraft. and placed it among science, which is the greatest contribution. That's why we are existing as a physician now. So this is why he's rightly called the father of medicine. At that time, the art of healing was along with witchcraft and magic, and he then said that it is a separate specialty, and he didn't do anatomical dissection. His school of thought and his disciples didn't do anatomical dissection, but he understood a lot of things from injuries in that time. You can imagine in those ages, battles were going on, and there were sports injuries, and he could gain a lot of information from it. For example, he graded the head injuries based on the location. For example, what he said was, if this is the coronal suture here, this is the sagittal suture. If you have an injury around brecma, that is the highest risk. But if you have an injury around the temporal area, the medium risk, and the least risk will be around the occipital region. That's how he graded it. So that is again quite remarkable that he thought about it. When you look at the aphorism from Hippocrates, you could see that he described what is the classical example of subarachnoid hemorrhage. So if you read this here, when persons in good health are suddenly seized with pains in the head and straight away are laid down speechless and breathe with stutter, they die within 7 days unless fever intervenes. I suppose if a fever intervenes, they die sooner. But this is a very classical description of a subarachnoid hemorrhage, which Hippocrates described at that time. And the next significant contribution came from Aristotle, who was again a physician. He is the person who coined the term anatomy, meaning to cut, and he dissected human body and named lot of structures. And he recognized meninges as separate things and differentiated brain from the cerebellum, the cerebrum from the cerebellum, and so he has contributed a lot to the learning of anatomy at that time. So when we go back, let me just go back to one slide. So here we are, we have the Pythagoras and Almachion, and also Hippocrates we talked about, and Aristotle. They initially did the contribution to help us with the anatomy of the human body. But to me, the biggest contribution came from this era, the Alexandrian period. In Alexandria, there were two physicians and physiologists or philosophers. They did human dissection, and they have contributed quite a lot to the anatomical knowledge. They lived around 335 to 280 BC, Herophilus and Erasistasis. And Herophilus is somebody who we neurosurgeons know, but not much known outside the medical profession. But he is the one, him and Erasistasis, and they were together. Actually, Erasistasis was a junior to Herophilus, and this is a woodcut depicting both of them here. And Herophilus was quite remarkable. He gave a lot of importance to measuring the pulse, and he is also timed it with the musical notes, and also devised a water clock. And he's rightly considered the father of anatomy. He dissected human bodies and learned a lot about the organs. And we know from neurosurgery that there are certain structures named after him. So, for example, he said nerves are different from the blood vessel, because when you open the human body in those times, you can't really differentiate which is the artery, which is nerve. And he said the nerves produce voluntary motion, unlike the blood vessels. He also described meninges and arachnoid. And torcular hierophil we know because it is so this is the torcular hierophil we know, torculus of Hierophilus, which is the word for wine press, and this is a wine press from the ancient city of Pompeii, which is discovered. You see the shape of it, the wine press, and this is exactly what is you see in the angiogram. and torcular hierophily is something which we know about. Then coming back to other structures, he said the ventricles are the location for the intellect, which was again then propagated by Galen in subsequent years. And he also described the cranial nerves. He described a lot of cranial nerves, but combined many of them together. And there's another one he described was calamus scriptorius. Calamus scriptorius is the lower end of the fourth ventricle. It's a shape like a pen, and he named it because it appeared like the tip of the reed pen, which was used in those time in Alexandria. And choroid plexus also he termed. Choroid plexus resembled the choroid, the vascular membrane of the fetus. So there's so many structures here. And another thing he described was the styloid process here. Styloid process we see from the temporal bone, because it resembled the pen, the styloid or the stylus. Also, he wanted to name it after because it's like a pillar, he named it after the tower. There was a tower in that city near the Gulf of Alexandria, the light tower of Pharaoh. So he named Pharaoh's Island, and he named it after it. So he named it. So this is what he did. He named so many structures, and he was the first one to distinguish the motor fibers from the sensory nerves. Even though we attribute it to subsequent physicians in the pre-modern time, he was the one first to say that they are different. And there was one structure which he described, mostly in animals, but this was an error. He said he described this something called rete mirabilis, which is like a vascular structure, and Galen, the great Galen, subsequently then continued to say this wrong notion, and which then persisted for another maybe a millennium or two, which is astonishing, because that was an error that was made, and only Vesalius in later years proved him wrong. So this is what Herophilus did, and along with this colleague, let me just go back. So then we come to his junior colleague, Erasistratus. He was a remarkable man, studied anatomy quite in details, and he was the first one to describe gyri in very details. And he considered that they appear like convolutions of brain matter, resembling to the intestines of animals. And he said the convolutions in human beings are much more than in animals, and that is a very significant finding. Later on, Galen did not believe it, but he was the first one to say it. And also, he thought ventricles were the seat of the animal spirit, or what he used to call psychic pneuma. And he also differentiated cerebellum from the cerebrum, and described this in detail. He was physician to the emperor at that time, the king of Syria, Seleucus. There is an interesting story which I hope to describe here. This is a famous painting. I'm not sure whether any of you have seen this. This is a painting by Jacques Louis David in 1774. And this is Erasistratus, the anatomist we are talking about. He was quite famous at that time, was physician to the king Seleucus. And this is a zine depicting a story from the life. This is the king's son, Antiochus. So this is Antiochus, and Stratonis was the name of this picture. So this is Stratonis, and this is Antiochus, the young son or the prince of the king. So Antiochus fell ill. Nobody knew what the problem was. He was in fever, he was having a tachycardia, he was collapsing at times, and nobody knew what was happening. Everyone knew that he was going to die, and nobody knew why, and king was frantic because that he was the only heir to his throne, and if he dies, the lineage is cut off. So he was desperate to find some treatment and consulted several physicians. Erasistratus was quite he was puzzled initially. He couldn't find out what's wrong with them. Then he spent time with this young prince, and then he also, like Herophilus, he was a great believer in measuring pulse, and he was measuring pulse of Antiochus by keeping near him all the time. And he noticed that whenever the king's wife, the king married when he was old, and a younger Stratonus was next to. So Stratonus was the stepmother for Antiochus. So what happened was Antiochus fell in love with Stratonus, and this is a forbidden love. He could not reveal it. There was no hope of getting Stratonus, and he said he would rather die than revealing this. So Antiochus knew this was a problem. But also he was in a dilemma. How would you say that to a king, to divorce his wife and give it to his son? But he knew that Seleucus had a tender heart towards Antiochus. So at some point he said to Seleucus, "King, I have found the reason for your son's illness. It is love sickness." Then king said, but Erastus said, "It is impossible to fulfill. We cannot cure him." King was astonished. "Why is that?" "Because I am the king. I can provide him with anybody who he wants." Then Erastus said, "It is my wife." He said, "It is Erastus' wife who he fell in love with." And then king said, "Then why don't you give your wife to him? Because that's the only way to save a boy and only way to save the kingdom." Then he pleaded. The Erastus said, "Would you do the same if it was Stratonus?" King, without hesitation, said, "Yes, I would." Then he revealed that in that case you could cure him. So he asked Seleucus to give Stratonus to Antiochus. So that is the whole story, and this scene depicts Erastus pointing towards the bashful young Stratonus, and the king standing beside it. So that this story was quite interesting at that time. But
Ramesh, it's 2 minutes.
Thank you. So I'll move on. So I didn't realize it would take that much of time, because when I was reading it, I didn't take much time to. But I will stop probably after this. We can see that this time Herophilus and Erasistratus, they have made greatest contribution, but there is some controversy about it. And subsequent physicians, and they criticize these two for the methods. They said they dissected live human beings. We don't know if that's true or not, and there's still a controversy about them, and whether they were asked to do so by the kings, we don't know, because they had the royal patronage to do the vivisections. And they said, especially Aulus Cornelius Celsus said, they must have dissected around 600 human bodies, live criminals. In fact, if you look at the one of the description of the vivisection, the criminal was brought and secured to the table using the length of rope, and he was tied down, and then he asked one of the assistant to cut the body, and then he also inside the lung to check whether it's pain sensitive or not. So these are there, but we don't know whether it's the right thing to do, or whether there is, their erga for knowledge we can absolve them of that crime. Probably that's why they are not given that prominence, such as Aristotle or Galen. Vladimir, I think I probably will stop with the one more slide. Then I'll do in the next series, because I think it will be, if I talk about Galen, it will be overrunning our time. So what I would like to say is that we owe these men our knowledge, and as a philosophy, we think we are doing surgical operations to cure, but the aim should be from surgery to no surgery. Just like I'll leave you with the final thought from a prayer in an Upanishad. So it says, Asatoma Satgamaya, Tamasoma Jyotirgamaya, Mrityuma Amridam Gamaya. This is from this Upanishad. It's one of the old Vedic textbooks, which essentially means lead me from the unreal to real, which means from ignorance to the truth. Lead me from darkness to light. Lead me from death to immortality. This is the prayer. same like that. We all surgeons, we learn this anatomy to excel in our trade. But I think as we progress, the intention should be the less trauma to the human body from surgery to no surgery. I'll stop this Vladimir now, and then I'm going to stop this screening, and I'll go on to the next session, maybe in the next lecture.
Ramesh, thank you.